Laura Kellams is the Northwest Arkansas Director of Arkansas Advocates for Children and Families. Her group has been a mainstay at the state capitol since 1977. As the name of the organization implies, Kellams Group will be looking to advance policy centered around kids and their parents in the 2023 session. We caught up for a conversation. This new legislative session that starts in January, a new governor, about a quarter to a third of the legislature is going to be new. You're going to be making some new introductions, I think, this time around. Kind of first of all, what's your sense of just what to expect with everything kind of changing from where we've been the last 8 years?
Well, we're really optimistic about the coming session and the possibilities for kids. For those who don't know, at Arkansas Advocates, we work on public policy solutions. We're really focused on children's outcomes and trying to improve kids' outcomes. And we look at policy solutions that we know can actually do that. And there's so much conversation in the past few months about improving kids' outcomes, from the conversations about children's literacy during the campaign and post-campaign with Governor-elect Sanders. We just have a lot of optimism about some of the possibilities. And so I'm going into this with a really good attitude, more than I've had in a long time.
Well, I want to back up from before they start school to the point when they're in the mother's womb, because there's a lot of things that I think there's a lot of conversations happening around Medicaid, around maternal and infant health. Arkansas is a state that ranks low nationally in terms of maternal health. What is Arkansas Advocates going to do to alter this trajectory? What are you going to advocate for?
Well, we have a couple of pregnancy and postpartum related solutions that we think could really make a huge difference, not only for new moms, but for the health of those babies. Depending on the year, half or more than half of the babies born in Arkansas are born to mothers who have Medicaid coverage. And so we think that there are a couple of really good tweaks that could be made to the Medicaid program that could make a huge difference in children's outcomes and in mothers' outcomes. One of them would be to fast track women who are newly on pregnancy Medicaid, women who apply for that program. When they find out that they're pregnant, they kind of get in line with all the other folks who might be applying for Medicaid in Arkansas. And one thing that we could do that other states do is like fast track that process, especially for pregnant women. So when they come in when they apply for Medicaid coverage, what we could do is look at their income level and immediately allow them to get that coverage if it fits the eligibility criteria, and get them that prenatal coverage as quickly as possible. That's actually what most states do. They kind of fast track that process, and we hope that Arkansas might look at doing that too. We're going to have, I think everybody's understands that we'll have more pregnancies go to full term in Arkansas under the new law. And so we want to make sure that those babies are born as healthy as possible and that their mothers have the healthiest pregnancies possible. That's one of the solutions. We have another one too that we suggest for maternal outcomes, and that is allowing Medicaid coverage, pregnancy Medicaid coverage, to be extended for a full year after the baby is delivered. Right now, that coverage goes for 60 days. And we know that babies and mothers would have better outcomes if their moms had that quality coverage for a full year. We have abysmal maternal mortality outcomes in Arkansas, and they're really worse for Black women in Arkansas. It's twice as bad for Black women in Arkansas, and then for all women, it's twice as bad as for the rest of the country. And so, and 90% plus of those deaths are preventable. And so we know that with coverage that lasts longer, we could really make sure that those women are getting the healthcare services that they need to prevent those unnecessary deaths that obviously are tragic for their family, especially for that new baby.
So Governor-elect Sanders has also said that education, particularly improving reading literacy, is going to be perhaps priority number one for her. It is certainly going to be a high priority. What does Arkansas Advocates suggest is the proper way to attack the trajectory that we're on there, which is we are reading well below where our kids are by third grade.
Yeah, it's just welcome news to us that there's so much conversation about childhood literacy. This is a key component of our work in public policy. You know, public policy created the poor outcomes that we have. And public policy can really make a difference in improving those. And so some of the suggestions that we have for really proven methods to raise literacy rates start early on when child's brains are developing, and then continue on through mentorships and programs that can really help get tutoring for kids. And so a really great example of a program that could raise children's literacy rates that are really great out of school programs in Arkansas. Those are after school programs and summer programs for kids. They have been proven to help kids catch up who might otherwise fall behind. So the types of kids who aren't reading at grade level can be the ones who could really benefit from high quality after school programs. And we have a lot of great ones in Arkansas that have kind of been cobbled together with a hodgepodge of funding that's like grant funding and local donations, but the state hasn't really made an effort to really invest in those programs. In the past couple of years, with some federal pandemic relief money, we have invested and recognized the importance of those programs to catch those kids up who fell behind in the pandemic. And we hope that the state will continue to invest in those quality programs that are part of the Arkansas Out of School Network. They're in, most legislators' districts. Families really depend on them. They're great for encouraging the workforce and for improving kids' outcomes as well.
Yeah, House Education Chair Bruce Cozart, who is going to be stepping away as chairman but staying on that committee, has indicated to me in a conversation that we had this past week on the TV show that it really requires just investing more money into people to go do this tutoring and this additional help that's needed. Is there anybody that has talked about a price tag for what some of that might cost?
Well, we in the past couple years, with the investments with the pandemic related money, we've been there's been around 20 million or so. I don't hold me to that number, but we're not sure what the legislature would be interested in investing in that. But we know that if we want to keep going what we have going, we're going to need to look at a number in that range just to keep the programs that we've recognized that we have invested in during the pandemic with this important federal money that we've had.
Senate President Bart Hester was on this show a couple of weeks ago, started a little controversy suggesting that we need to eliminate all the extracurricular things that are going on until kids can read where they're supposed to be at by third grade. I'm not sure how many kids are participating in sporting endeavors in first through third grade that might be cutting into their reading time, but it seems to me that we can walk and chew gum and still do some of these music and history and other programs. I'm just going to go out on a limb and say that you probably don't advocate that line of thinking that Senator Hester had there of we need to eliminate everything and strip it down. But I think his point is that he wants to make it a high priority as well.
Well, and one of the things that's great about after school and summer programs is that they have that opportunity for activities as well as the tutoring, and they're the best ones and the high quality ones are aligned with school curriculum and can really make that connection. So I think it's a really good example of, like you said, you can walk and chew gum at the same time. You can have an outlet for kids where they can have team building and learn from mentors. At the same time, they're working off some of that energy, and their parents are able to work later in the day and have a safe place for their kids to be.
Which is a great segue to my next and final question here. Yesterday, Wednesday, the Women's Commission that has been studying a variety of topics that are related to women in the state of Arkansas, particularly working moms, delivered its report. Childcare is a huge issue that has been identified, and I've moderated some panels where this is not a new conversation. What's necessary to address that shortage? I think there's a shortage of facilities, and there's a shortage of people to work in those facilities from the childcare workers that I've talked to. Is it just that simple, or are there other complicating factors?
We were really pleased to see the concentration on that and the recognition. I mean, it's not rocket science that, when moms and parents can't get high quality childcare or even access to any childcare slots in some areas of the state, that they're not going to be able to join the workforce, that they're not going to be able to participate at the level that otherwise they could. So we were really glad to see the suggestions that they made. And I do think that there were some really good solutions that they mentioned. I mean, really trying to bring together the public sector and the private sector to recognize that not only is this good for moms and working parents, but also to get those kids into a quality program when their brains are developing. If we want to improve childhood literacy, that starts, like you said, in the womb, and also in those very early months and years when children's brains are just exploding with new development, and so with new brain development. And so we really want to make sure that people recognize that. And I think that the best solutions really recognize that the high quality and the programs that can really help kids learn when their brains are developing are what's most important. And that's the kind of investment that pays off for all of us in the long run. Our economy pays off. It pays off in the workforce today and tomorrow. And so we were really pleased to see those solutions offered. And we look forward to working with any of the lawmakers, the governor-elect, the members of the Women's Commission who want to work on some pragmatic policy solutions that would work in Arkansas. That's what we're all about.
That's Laura Kellams with Arkansas Advocates for Children and Families. You can catch more of our interview at talkbusiness.net. We are back to wrap up right after this.